Hi there, this is Dr. Sherman from the Delmore Cosmetic Medical Center. We're here today to talk about a really exciting new development in the treatment of cellulite. Now, cellulite is a condition everybody has, mostly females, I should say, but some males do occasionally get it. But basically, it's a condition that develops in our lower legs, and it appears as a undulation of some depressions and bumps in the lateral thighs, but it could be also in the buttocks and in the anterior thighs. There have been multiple different non-surgical treatments, creams and garments and special external lasers that supposedly were supposed to help this, and indeed there may have been some short-term or temporary improvement in cellulite, but nothing of a long-term nature. And the reason is because the cellulite, we now know, is made up of pockets of fat that are being held together or held stationary with some fibrous bands that go from the undersurface of the skin down to the deeper fatty tissue areas. And so we have to treat both of those areas, and sometimes in the depression areas we actually have to fill those areas once we release them. So how are we now doing this? We're now taking a minimal invasive approach, which means that there is a small incision. We introduce our instrument called the VASERSmooth, and you can refer to the pictures that kind of demonstrate that, with a special type of ending on the cannula. Now that produces an ultrasonic energy focus that permits us to go in and loosen up the fat that's pocketed, and also in a kind of a whipping motion release or cut through those bands in a very, very minimally traumatic fashion, so that there is minimal bruising and swelling associated with this procedure. Now, after these areas have been treated, we have a potential depression, and we have to potentially fill that up. And so there are several techniques such as lipo disruption and lipo filling, where we use the patient's own fat that's associated right next to the area of the cellulite, or we actually harvest some fat from another area of the body and we inject it into that area to fill that space between the skin and the deeper tissues to give us that nice smooth finish. The good news is that if this is done properly, those improvements in the appearance appear to be very, very long lasting. We can't say forever, but certainly we now have evidence that it appears to be over 2 years and growing with no sign of reoccurrence, which is, of course, fantastic news. So if you'd like to see more information or talk to us about that, please refer to our website or our phone number. Give us a call. We'll set up a contact consultation and describe this in detail, and of course answer all your other questions. Thanks for listening.